said, medical insurance is obligatory. Everybody pays Social Security. Now, the Social Security supplies indirectly the medical services through sick funds, HMO, healthcare management organizations that are supported by the Social Security. Since the basket of services is never enough, a lot of people will also make private insurance. And in the private insurance, you are entitled to get services which are not included in the national basket. For instance, if you need a major operation which is not done in Israel and you have to travel to the United States or to France or to England, to wherever there are experts, the private insurance may cover it, while the basket of services, the national basket of services, may not cover it in most of the cases. So definitely, yes, there are private insurances. The pharmaceutical market in Israel is actually more and more a part of the global market. All the big multinational companies such as Bayer and Pfizer and MSD are represented in Israel, and they have their own companies, their own subsidiaries, and they are managed by their own managers, and they report directly to the headquarters of their companies. So we have most of the, almost all the products that you can find in the Western countries, such as the United States and Western Europe. Where nowadays there is a transparency with the activity of the companies. Most of the multinationals are global companies, and they have to unify the activities all over the world. So officially, all of them, they have their own internal ethical codes and regulations, and I know that they are very strict, or most of them at least are very strict to follow up the regulations and the ethical codes. The medical system in Israel is more or less a socialistic system in the way that medical coverage, medical insurance is obligatory. Everybody has to pay a certain percentage of her income for Social Security, and the Social Security finances four main sick funds like HMOs in Israel, and they supply the services, to the medical services to the population. The hospitals in Israel are owned either by the Ministry of Health or by the sick funds, or we have also public hospitals that are non-profitable organizations like the Hadassah Hospital and some others. We don't have too many private hospitals. In fact, only in the last 3 years we have a new and modern hospital around the Tel-Aviv area by the name of Asuta, which is a relatively big hospital, and it supplies private services. However, many of the services that they supply are private but are covered by the HMOs, by the sick funds. different statutes, different laws in Israel, and the medical services are covered by a statute for national insurance. And this statute obliges the state through the sick funds to supply all kinds of medical services. However, this is not an unlimited basket. There is a certain basket of services which includes the all kinds of medical technologies that the patient is entitled to. And of course, one of the major factors in this basket is are the pharmaceuticals, the drugs. Now, there is not every drug is in the basket. There is a major pressure on the committee. There is a governmental committee composed of doctors and representatives of the sick funds and public figures and some clergy, and they have to decide which drugs will enter the basket. Now, the key word is prioritizing. Which drugs should be in and which drugs should not be in. Because when you take out some drugs from the basket, that means that some patients will not be treated. And if you are talking about major diseases, severe diseases, the outcome can be very, very severe and harsh and even fatal to these patients. So we have a constant fight between patient organizations and the government and the committee. And of course, in the background, there is a big lobby of the pharmaceutical industry because all multinationals, they have lobbyists that are going to the members of the parliament, and they are going to the committee, and they are everywhere, and they are producing media articles in the newspapers, in the television. So to create pressure, like for instance, the Cancer Society in Israel, the Patient Cancer Society, and they deal with different kinds of cancer, and of course the new drugs for cancer are terribly expensive. So if a patient has to spend something like $10,000 a month for medication, most of the people cannot afford it. The majority of people cannot afford it. So obviously there is always a fight between the patients' organizations and the suppliers of the medical services. The long waiting list to be approved in Israel. There are some exceptions, but in most of the cases, when a drug company wants to register a new drug in the country, they have to apply to our regulatory authorities, which are the pharmacy department of the Ministry of Health. It's like our own FDA, if you want. And they have to submit, the pharmaceutical companies, they have to submit all the data, and this is analyzed in the Ministry of Health. And this is a lengthy procedure because the Ministry of Health, the pharmacy department of the Ministry of Health, is understaffed. They have very few people that can handle all these issues. So it takes a long time. But once it is approved for marketing in Israel, then they have to go to the second phase, which is to be approved on the formulary of the basket of services. Because when a drug is just registered in the country, but it is not approved by the basket of services, the use is very limited. So they want to widen the use as much as possible. So here they come again to the lobby in the parliament, to lobby in the committee for the basket of services, which is sometimes it's a very tedious struggle. Like, for instance, if you have to prioritize, what do you prioritize? Anti-cancer drugs, or perhaps antihypertensive drugs? Because a lot more people suffer from hypertension than from rare forms of cancer. They approved, for instance, contraceptive pills for girls. Now, contraceptive pills is more of a lifestyle. It's not a must. But then they realized that if young girls get pregnant and they have to discontinue the pregnancy, that may pose some dangerousness on the girls. So they approved the contraceptive pills. But in most of the cases, they will not approve this kind of drugs because it's only lifestyle. They will approve drugs which are really for treatment of major diseases. Well, we do have a few companies that manufacture locally. The biggest company in Israel is Teva. Teva is, they have some innovative drugs, but most of the activity of Teva is in the generic area. And Teva is considered nowadays one of the leaders in generic pharmaceutical market worldwide. And actually, according to some reports, it is the biggest, the largest generic pharmaceutical company. Its base is in Israel, so it is manufacturing also in Israel. But there are some other companies that produce in Israel. Most of the companies that produce in Israel produce generics. It may be generics that had been developed in the formulary department of these companies, or it may be generics that had been granted by the multinationals according to different commercial contracts. Well, unfortunately, I have I cannot say too much about the Ukraine because I'm not an expert on the Ukraine market. I was just able to listen to some presentations today and yesterday about the Ukraine medical system, and I can understand that Ukraine has the same problem like in Israel, limited resources and high demands. It goes not only for the pharmaceutical market, it goes also for the doctors' remuneration. Like the salary of doctors here is very low. Same is in Israel. Well, it's not very low, but it's low. And only recently we have had a few strikes of doctors, which may go even further in the near future. They may strike and not come to work, and the hospitals will work only in a limited form. They will stop all the elective operations. They just deal with emergency cases. So it's a problem. We did have a strike of doctors 10 years ago, and the conditions were improved, but for 10 years there was a stagnation. So now they started again to improve their position. Because for the young doctors, it's quite difficult. For the young doctors, they work very hard. They do shifts once or twice a week in the hospitals, and the pay doesn't reflect the efforts and the long year studies that they invest. Well, officially, there are no relations, but unofficially, through the lobbyists, there is a great deal of pressure on the government, And of course, people from the pharmaceutical industry try to get close to the government people and to people in the HMOs, in the sick funds, and they work together, so they know each other. But I cannot say that there are really official contacts or official relations between the government and the pharmaceutical industry.
And maybe last question about future of pharmaceutical global market. What do you think about what we have in future?
Well, one of the areas that is we are going to see a shift in is the transfer from chemical drugs to biological drugs. Now, in the last years, we have, especially in the areas of cancer, we have the biological drugs, while in the past we have had the chemical substances that used to kill the cancer cells, but they also were very toxic to the entire body because there were poisons, and the poison cannot differentiate between a cancer tissue and a healthy tissue. Now there are the biologicals which are operated through monoclonal antibodies that are targeted to the cancer tissue. So they adhere to the cancer tissue and they release the poisonous drug to the cancer tissue and with minimal effect on the surroundings. And this is really it's like a guided missile to the cancer tissue. So this is really fascinating in the future of the pharmaceutical industry. Plus the fact that the traditional research and development will go on, and they will find new drugs for all the diseases. There are some areas that we really don't understand too much about them, like for instance psychiatry is a problem. But all the other chronic diseases are also a problem. Hypertension, diabetes. People are stabilized. Nowadays, you can maintain people on a stabilized condition in hypertension, in diabetes, in all kinds of other chronic diseases, in a stabilized condition for many, many years until they are very old. With the mental, psychiatric diseases, it's more problematic because many of the drugs are working on a base of empirical observations, and we don't know exactly why the mechanism is really improving or is improved in spite of the drug.